Hello, everyone. My name is Arwa, and I'm the founder of Heal Physical Therapy, a mobile physical therapy and wellness service in the San Francisco Bay Area. My goal is to help older adults maintain an active and a healthy lifestyle, overcome their fear of falling without pain medications and surgery.
Hi everyone, I'm Linnet. I'm also a physical therapist like Arwa and I work in New York City area. I've been working as a home care physical therapist for last 5 years, providing in-home services to the elderly in their physical therapy needs.
So, Linnet and I are here today to talk about a very important topic about falls amongst the elderly population. Statistically, 1 out of 3 adults over the age of 65 fall each year, and 1/3 of these falls result in serious injuries, hip fractures, wrist fractures, or even head trauma. Now, most of these falls are due to really avoidable mistakes that can be easily fixed. So, Lynette, do you want to talk about what we are going to cover today?
Yes, so importantly, you're absolutely right, Arwa, that falls are a very big problem among elderly, and as you said, 1 in 3 elderly falls. So that is like statistically a big deal. Today we're going to be covering the most common causes of falls, how it can be prevented by making small changes around the house or in your environment. We are also going to be talking about 2 tests that people can do at home just to quickly assess their balance. Some people don't even know that they are at risk of falling. So by doing these tests, they can be made more aware. And lastly, we are also going to talk about how physical therapy and how exercise can help them with their prevention and treatment post falls, or even to prevent a fall. Based on my experience working as a PT, what I have seen in my patients, the most first common cause is tripping. That's usually what happens among patients. They trip either over their carpets, over a doorway saddle, outside if there is a cracked sidewalk, or if they have stairs outside, if the surface is not even, they usually trip and have a fall. So that is, in my experience, the number one cause. The next is if they make a sudden turn while walking. I guess their body is not used to the sudden change or the sudden movement, even if it's with the head turn or the whole body turn. That's another cause of fall that I have noticed in people. Next is if they're taking many medications. I think some of the medications have side effects that make them dizzy, and that can lead to a fall. What do you think?
Yeah, I think you're absolutely right, because anyone taking more than 4 medications at a time are at a high risk of falling.
Exactly.
So that's a huge factor. And then also things like having diabetes can cause peripheral neuropathy.
Exactly.
Not having enough sensation in your feet, so you don't have that connection to the ground, right? And that
to
can
make you feel more steady. Yes. And
unsteady.
Also walking pattern, some people, their walking pattern is not right. They take very small steps when they are walking, or their feet are too close to the ground when they are walking, so that needs correction. And people don't realize that, but it just happens over age, that your movement pattern gets smaller and smaller.
Exactly. And as we age, sometimes the vision is affected. Things like glaucoma, or not having vision in one eye, or like
cataracts is another problem with the elderly.
Right. Or affected peripheral vision, so you cannot see what's in your surroundings, and that can easily lead to a trip or a fall, right?
Right. You don't see any obstacles in your surrounding, and that can easily cause you to trip, or just have a fall. So yeah.
And even like inner hearing problems, like can of cause vertigo, or that can affect your balance, which is also one of the.
That's right. BPPV is another cause, where
exactly,
just because of the crystal repositioning, people don't have that sense of balance, making them unsteady, and having causing.
Right. And also like not having enough light. Sometimes when you're going to the bathroom at night, and if you cannot see,
yes,
right.
Arva, what do you think? Like you have started your own heal physical therapy, and you provide in-home services. So, what kind of advices do you give people, for changes that they can do in their surroundings, in your basically in your field? What have you been doing?
Yeah. So, whenever we go to a patient's house, home safety assessment is like a huge part of that, because lots of people, as I said before, right, most of the falls are easily avoidable by making small changes in your surroundings. So modifications in your surroundings, for example, say installing grab bars in the bathroom, so that you can get in and out of the shower easily when you're sitting on the toilet, and when you're trying to stand up, having that grab bar to help you stand up safely. Or if you're not able to stand in the shower because of poor balance or not having enough energy or endurance, then having the option of like a shower stool or a shower bench, so that you can conserve energy that way, so that you don't get tired, or if you don't have enough balance to maintain that standing. So I have like some patients who tell me that they stand on one leg and try to like wash the other foot. They raise their foot up because they don't have enough mobility to bend down. Yeah, so I would definitely recommend for those cases like a shower stool or a shower
And how
bench.
about like a bedside rail? Like sometimes people just roll out of bed, they don't have enough control, enough core strength to pull themselves up. So having a bedside rail is also one of the things.
Bedside rail is important, so that they can pull up themselves, use the upper body. Most people have good upper body strength, but they don't have enough core and lower body strength,
Exactly right, yes. And the carpets, I mean, I have a lot of my clients who have, old fashioned rugs, and, they don't want to get it because they have emotional sentiments. So I think it's recommended taping it down on the floor, so, you don't have loose ends where you can easily trip. So that's another important thing.
I also tell them to get rid of the rugs as much as possible, especially in the bathroom, right? People have like all sorts of rugs in the bathroom, which again exposes them to a risk of falling. But obviously, if there are sentiments attached, then the double masking.
And how about slippery surfaces? Make sure if the wood or your flooring is just polished, to be careful, because you can easily slip. If at least in New York, where you have snow, you have icy surfaces. So you have to be very careful about that, because a lot of people slip and fall like that. So that's another important answer.
Yeah, for sure. Also, lots of people they like to wear socks at home. Sometimes when it's like winter. So making sure that you wear non-skid socks and not just the regular socks, which exposes your risk
the socks that have ridges on the bottom, so you have a grip. Yes, that's
the ones they give out. Yeah, the ones they give in the hospital. The ones rubbery, the sticky
slipping. Correct. How about stairs? I mean, since you're in California, people live in houses, so I'm sure they have stairs inside their house, or just to get inside the home also. So I guess having a railing is important.
Handrail is important. Stair lift is another option. If you have rails, making sure that the rails are not loose, getting your stairs checked by a professional, having contrasting tapes, because as we grow older, our depth perception goes down sometimes.
That's so right.
So like having contrasting or neon tapes on the step, so that this is the next step, and then so
and
on
even
so
for
forth.
vision, even for vision, I think it's important that you get that visual feedback, because you have that tape on the floor, so it's important. And at nights too, I mean, sometimes people have those night lights along the pathway, because it makes you more aware, and you can see the ground properly. That's
right. Making sure that you have a night lamp at your bedside table, so as soon as you wake up, you don't just get up immediately. You slowly sit up at the edge of the bed, then you switch on the night lamp, and then take your time, because sometimes when you're at night, when you suddenly stand up and go rushing to go to the bathroom, our blood pressure fluctuates, and some people who
that's another, and that's an important cause of fall too, syncope. When your pressure with change of body position. I have advised my patients that as soon as they change, so if they're sleeping and if they sit up too soon, I always have them sit for at least 10 seconds before standing up. So between like transitioning positions, you wait a couple of seconds before you move, because your blood pressure needs to be adjusted. How about the cabinets? Like some people have tall cabinets. If
Tall
they have
cabinets, right?
so
Yeah, just
instead try to lower the things down so it's easily accessible.
easy for them to reach.
And
And
one
then
more thing I noticed is the clutter. Before we move on about the clutter, a lot of people don't realize, but they have papers on the floor, they have boxes on the floor. So I always advise them to to clear everything out, because it is
right.
so easy to trip over small things around the house. So I think that's
Especially if you're using an assistive device like a walker or a cane, you need more space. Clear your pathways, clear your pathway from the bedroom to the bathroom and the kitchen,
yeah,
all of that.
especially in the city, I see that much, because you live in an apartment, you have so much stuff. It's smaller apartments and more stuff. So people end up just storing wherever they have space available. So, but that's an important consideration to keep all the pathways clear.
If you feel like you're cruising along the furniture a lot, or if you're trying to rely on your walls, or say your bed frame or your table to walk and to kind of maintain your stance or your stability, then you might want to get evaluated, right? Just to make sure that if you need a walker or a cane or anything of that.
That's exactly what we are going to talk about next. How to self-test for people who are not aware that a lot of people are not even aware that their balance is off. I'm going to go ahead with the first one, which is single leg balance. So this is a very easy test, can be done by anyone, anywhere. You just stand on your dominant leg, lift your other leg up, and just time yourself and see how long you can stand on that leg. If your score is below 12 seconds, you're at a higher risk of falls. If it is below 5 seconds, that risk doubles. So if your score is within that range, make sure you get a consultation. It's very important, because people don't even realize, but single leg balance is so important. We shift balance from one leg to the other when we are walking, when we are doing things around the house, but that balance of one leg is so important.
Right.
One thing I want to mention before people try, if they're trying it on their own, the single leg balance, make sure you're standing in front of a couch or have something behind you, just in case you lose balance. Make sure you're standing in front of a wall or a chair to hold on to.
So I'm going to talk about the timed up and go test. Now, find yourself sitting on the chair, have a stopwatch, and then identify an area of 10 feet where you can walk. And if you are using a walker or a cane, just use that for the test as well. So as you would walk normally, so start the timer and then walk 10 feet and then come back and sit on the chair. Now, usually that takes about 12 seconds for an older adult. But if you take more than 12 seconds, then your chances of falling increases marginally.
We highly recommend this, because preventing a fall is so important. Once you have a fall, the fear of fall increases, people's activity level goes lower, their confidence level goes down. So having that prevention is so important. People need to be made aware of how they can get themselves stronger and avoid any falls of future, as we talked about environmental changes. So small things that you can do to easily prevent.
And I also wanted to add, like a lot of people have this idea that if you fall once, you're not going to fall again because you're going to be safe. But that's actually totally the opposite. Because if you fall once, your chances of falling again are much, much higher. Linnet, you have your own YouTube channel, Fitter with Linnet. Can you tell us a little bit more about that?
Yeah, so I started Fitter with Linnet with the goal of providing seniors an option of doing exercises by themselves, because I mostly see that seniors are limited in what they do. A lot of them just think that walking, if they do 30 minutes of walking every day, that's enough for them. But actually it is not, because you lose your muscle strength as you age, and every year that strength significantly diminishes. My goal of starting this channel was having them, that they can easily work out at home. They don't even need any equipment. development,
Mhm.
and how they can get their muscles stronger in their lower body, upper body, getting their core stronger. And
Mhm.
in fact, exercises also helps with your osteoporosis. If you have a lot
Mhm.
of elderly have osteoporosis, that increases their risk of
Mhm.
fractures because of fall.
Right.
So
Right.
generally exercising is
Mhm.
really beneficial, and that was my sole aim, because on YouTube you have a lot of exercise options for younger
Yep.
people,
Right.
but not so much for the seniors, and that's my main aim of doing this channel.
That's amazing because like I know that my grandma, she likes browsing YouTube a lot, and then she likes doing these exercises. But then sometimes I tell her that you cannot do all the exercises. Everything is not safe for you. So having something like that really helps. Yeah.
Yeah, and having a PT, because I have experience working with elderly, so
Mhm.
I know how to
Mhm.
safely do these exercises. I try to
Mhm.
explain what posture you should have,
Yeah.
how you should breathe when you do the exercises, because all those small things matter.
Right.
If you
Right.
do intense exercise without proper training,
Mhm.
you might end up hurting yourself too. So you
Right.
need that
Right.
kind of training from somebody who is a professional and who knows what they're doing,
Exactly.
right?
Right. No, that makes sense. Yeah. So let's see what kind of exercises can help in preventing falls. I feel like strengthening and resistance training is would be the number one and the most
Yes,
important.
yes, they can use
Yeah.
weights, resistance bands to help,
Bands.
getting the legs stronger.
Right.
Yes,
Right.
definitely. You can do add aerobic exercise to
Mhm.
improve your exercise capacity.
Right.
Doing some people like to swim, getting in the water is their favorite thing. So swimming is also one of an excellent
Mhm.
form of aerobic
Nice.
exercise. Going for walks, but just walking is not enough. So you have to,
Right.
along with walking, you have to do some kind of strengthening
Like balance
exercises.
training and core exercises. Right.
Absolutely, yes,
I
yes.
think training the core is so important. Most of us don't like using our core. We don't engage our core for anything, right? And nowadays we find ourselves sitting so much or longer. So I feel like core strengthening and activating your core and your glutes, the bigger muscles,
Is
that's
really
important for.
important, yes.
Yeah.
And as a physical therapist, you can also treat specific causes too. If somebody has vertigo or dizziness because of
Mm-hmm.
certain conditions, as a PT, you can address that too. So people
Yep.
need to be aware that physical therapists can treat a wide range of conditions
Right.
and also
Exactly.
help with preventing falls. Yes.
Yeah, and as like our as we grow older, our balance definitely reduces or is affected a lot because of various reasons we discussed before.
Yes.
So incorporating some kind of balance training in your routine or in your workout regimen is important. Yeah.
Yeah, exactly right. Just doing one form of training every single day is not enough. Just by doing
Mm-hmm.
only what you have to try to mix and match different form of
Yeah.
exercises, to
Right.
get your body more stronger. Yes,
Right.
definitely.
Some of my patients tell me that I ride the bike every day for 30 minutes, and that's my exercise. But I try to explain it to them. I let them know that that's not enough. You have to mix your training. You don't need to do the bike for 30 minutes, or if you love doing it, it's okay, go ahead and do it
But
for
you
30
have to
minutes.
add something else along
Add
with it.
some other component,
Yes.
right? Like balance, because I mean using the bike just requires some other different kind of muscles, but
Yes,
when you're
and
doing.
plus, just by riding the bike doesn't mean you will be able to stand on your one leg for more than 12 seconds, as we
Exactly.
just.
Right.
So
Right.
that's a different form of training that you're going to do.
Form of
So
training, right? And at the same time, like obviously riding the bike gives you lots of other things, like it increases your endurance. It's a good aerobic
yes,
activity, activity tolerance. So like for the timed up and go test, right? It will give you that
yes.
tolerance to walk that longer. So it helps in one way, but you also need to focus on other activities that
On the
will help
other things
train
as
your
well,
other,
yes.
right?
And
Yeah.
I think that's why physical therapy evaluation is so
So
important. I
important
mean, if
it
you're
is.
65 years and up, you should
Mm-hmm.
consult with a physical therapist, because there are
Right.
so many things that you can address and
Yep.
prevent. Because
Mm-hmm.
just by doing small things, so why
Right.
not just do a small consult with somebody, just like you visit your doctor for your physical. So everybody goes
Exactly.
for their annual physical checkups, right, to check their heart, their lungs. So
Mm-hmm.
why not check with a physical therapist how their balance is, and what they can do to
I would.
improve their,
Right.
yeah.
Yeah, no, I would definitely recommend like a semi-annual or even an annual physical therapy evaluation, because there's so many changes happening. Your medications are changing, your environment is changing. So definitely just an evaluation to check if you are at a high risk of fall, because besides the 2 tests that we described, those are fairly easy to administer. There are so many other tests that your therapist can actually do or perform on you, make recommendations if you need any assistive devices. So there's lots of things that they can help you with, or suggest modifications in your surrounding. Like, I know there are options where you can have so many devices to make your life easier. So if you if you or anybody feel like you're at a high risk of falling, please contact your physical therapist, or if you have any other questions or any concerns, contact us. Our information will be there in the links below.
Definitely, yes. And if anybody have any questions, they can always reach out to us. We are here to answer, so don't hesitate.
Right. And thank you for being with us here today. Thank you so much, Linnet, for joining me today.
Nice seeing you.
Nice seeing you too. Okay, take care.
Okay, bye.